Hi, I'm Dr. Chuck. Today on Your Filthy Mouth, we're going to show you how to find a good dentist.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, I'm Suzanne Lynn, and I'm here with Dr. Chuck, and today we're going to be talking about finding a really great dentist. We do these shows on Your Filthy Mouth to share with you how what's happening in your mouth affects the rest of your body. But before we jump into today's show, we want to encourage you to hit the subscribe button. We don't want you to miss any of the episodes. So Dr. Chuck, today, very important, how do you find not just an okay doctor or a good doctor, but a great doctor?
Well, in every town, you've got good dentists, and in many towns, you may have some other than good dentists. You have good physicians, and you have other than good physicians. And so what we want to do is try and find the right dentist for you. And one of the things I've done is kind of put together a checklist so we can see, is that the right one for you or not?
Okay.
And just so you know, you may have to go to 2 or 3 or even 4 different dentists before you find one that you feel comfortable with, that knows what's going on. So don't give up on the first one.
Okay.
You may have to look a little bit.
I have a feeling before we jump into the list, the cheapest one is not going to be on your list. Right?
Well, you got to be careful when you're looking for bargains in dental care and parachutes.
Right.
You know? Okay?
Oh, that's good,
not always
yeah.
a good thing.
That's
you know?
right.
Okay.
All right, let's dive on in.
So about 12 things. Number 1, do they listen to you? Okay. Number 2, do they review your medical and dental history? 3, are they thorough with your examination? Are you getting the right radiographs, x-rays that you need to do proper diagnosis? Are they doing a gum examination? Are they checking each tooth by tooth, going through the whole mouth, looking for cracks, decay, recurrent decay, those things? Do they check your bite? How are the teeth coming together? That can give you headaches and all kinds of other problems. Do they offer saliva testing? Oh my gosh, that's a whole new area that is just fantastic.
Why is that?
Because now you can identify the bacteria that you have in your mouth. And you can come up with some specific oral antibiotic rinses that you rinse with. You don't have to swallow it. So now you're just killing the bad bacteria in your mouth without killing the good bacteria in your gut.
That's really cool.
But you have to know what you're killing. You have to know what's in there. So you have to do the saliva testing first.
All right, so that's a phone call, part of making your appointment. Does this dentist do saliva testing?
Do they do saliva testing? Is that an option? Okay. Do they screen for cancer? Did I say that already?
No.
Yeah, screen for cancer. That's a very important thing. In the United States, 1 person an hour dies from oral cancer, and there's no symptoms.
It doesn't hurt?
No. I had a patient, this is not too long ago, she says, let me tell you about my brother-in-law. Now, he had not seen a dentist for years. Finally went to see a dentist. Dentist did an exam on him, referred him right over to the oral surgeon. The oral surgeon did an exam, ran a couple tests on him, and says, you've got about 2 months to live. And in 5 days, he was gone.
Gosh.
No pain. People think if it doesn't hurt, it's okay. That's just not true. High blood pressure, diabetes, glaucoma, cancer, no pain. Okay, so you've got to look at these things. Dental disease, too. Gum disease, no pain. Doesn't mean it's okay. There's just no pain. Do they screen for sleep-disordered breathing? That's another thing. Depending on who you listen to, between 20 and 40 million Americans have some type of sleep-disordered breathing. Well, how do you know if you have it? Are they screening for it? There's certain questions you can ask the patient. And
you know if you're not sleeping well, and that affects the rest your whole life.
Well, the challenge is you might not know that you're not sleeping well. Okay, you wake up, you feel tired. Well, I do that all the time. Well, how did you sleep? And so there it used to be you had to go to the sleep lab to get the test. Now they have home sleep studies that you can do. But whatever it is, you have to find out, do you have it or not? And again, that has to do with the mouth. The mouth isn't just teeth and smiles. The mouth is infections. The mouth is airway. The mouth is the bite. This all has to do with your general health, not just a smile and chewing your food.
I mean, you haven't even completed your list yet, and I'm already blown away. So if we have headaches, that could be mouth-related. A bad night's sleep could be health-related. Heart disease could be mouth-related.
Yeah.
You know?
Yeah, the mouth is the front door.
Yeah.
This is where everything, physicians are really good about recommending you get your back door checked, right? You need a colonoscopy.
Yeah.
But what about the front door? This is where everything is coming in. So do they review the findings with you? So once the dentist has gone through and they find all this information, do they go over it with you? Or do they just tell you this is what you need and get it done?
Right.
Well, to me, it's always good if the patient can understand why this needs to be done, because that helps them be more motivated.
Sure.
You know, it's like, oh, I got that going. I don't want that in my mouth. Let's take care of it.
It kind of ties back to the number one, does your dentist listen?
Communication.
Yeah, right.
It's really important. It's really important. once they tell you what's going on, do they offer you alternatives? Because there's more than one way to skin a cat. I mean, when I look at the highway, not everybody's driving a Cadillac. I mean, but everybody needs transportation.
Right.
So we need to find out what can we do to make your mouth healthy. Maybe not a Hollywood smile, but no infection,
Right.
no other things going on that's going to affect the rest of your body.
Wow.
So they offer alternatives, and will they let your physicians know what they find in your mouth? Because if your physician is making medical decisions for you and you have some medical things going on in your mouth, which would be infections, gum disease, dental infections, airway issues, bite issues, we've got to look at the whole picture. So if you can let the physician know what's going on, that might modify some of their recommendations. Sometimes they're treating infections and they have no idea where the infection is coming from. If you can tell them, hey, we've got periodontal disease going on, that could be the source of the infection that is affecting other areas of the body. The physician would like that information.
Have you actually had patients that have been able to come off medication because the source of their problem was the mouth? Has that
Yeah.
actually happened?
Oh, yes, yes. If all you're treating is symptoms, you're never going to get rid of the problem.
Right.
In the mouth, a lot of times this is the source. This is where the bacteria are coming from. This is where it is. Once you clean that up and get that healthy, that affects the rest of the body. And so I had, quick example, one patient, the only medication she was on was high blood pressure medication.
Okay.
We did an examination. She was a new patient. We did an examination on her, found out she had an abscess on a tooth. We took care of the abscess. She came back 3 weeks later, said, guess what? I don't even need my high blood pressure medication anymore.
You're kidding. Wow.
Can an infection
Wow.
raise the blood pressure? Absolutely. Your body is trying to get rid of that infection going on. But what's the side effects of the
Wow.
of the medication? It dries out your mouth. Well, when you have a dry, high blood pressure medication for many, many people will give you a xerostomia or a dry mouth. If it dries out the mouth, now you don't have the saliva to dilute the acids that the bacteria are producing, so your gum disease rate goes up and your cavity rate goes up. So not only by putting this patient on blood pressure medication where you're only treating the symptom, not the source, but you're actually making the situation worse.
Because you were creating
A dry mouth.
Right.
Okay, so
Wow.
can people get off of medications? Yes, they can.
Wow.
Yeah, let's start with health. That's the number one thing.
Okay, so the second thing that goes into finding a great dentist, what's that?
Well, first of all, you want to get out there and start looking around for that right dentist. Number two, when you find the dentist that you trust, let them do their job. Let them do their job.
What does that mean?
My dad gave me a piece of advice when I was growing up, and this is whether you're looking for an auto mechanic, an electrician, a doctor to work on you. Find someone you trust and let them do their job. Don't second guess everything they're doing. And if you don't trust them, go find somebody else. Now, that doesn't mean you can't ask questions. That doesn't mean you're not interested in what's going on. But if you don't trust them, find somebody else, because it's your health. It really is.
I just want to share a story. When we moved to a new area, went to a dentist, and there was something in my gut that didn't feel right. And I don't know what it is. He might have been a fine dentist.
Yeah.
He might have done all the things on the checklist. Something
Yeah.
didn't sit well with me, and I couldn't go back.
Listen to your gut. I can't explain
Yeah.
why that tells us so
Yeah,
much, but
yeah.
there are certain times in my life that I wish I would have listened to my gut.
Amen. Preach,
Oh,
brother. Yeah.
Okay?
Yeah.
But that's why, listen, your body will tell you things. And if you're comfortable, if it's making sense, if they're showing you what's going on, if they've got nothing to hide, wonderful. And again, there are good dentists in every area. So, but again, you got to be careful.
The more I think about it, the communication, I feel like there was not transparency with that dentist I'm talking about. And the communication is such a big part of it. And, I mean, I know that there's a lot of medical and physical things that are on your list, checking this, x-raying that. But there's something, sometimes you can't, it's not tangible.
That's exactly right, but it's a feeling, and it's either a comfortable feeling or an uncomfortable feeling. And if you feel that dentist, man or woman, young or old, it doesn't make any
Right.
difference, because they're, if you're able to communicate, you can see that they have your best interest in mind. That's wonderful.
Right, right.
But if you feel like you're in a car lot, okay, and they're trying to sell you
Yeah.
everything under the sun,
Yeah.
Listen to your gut.
Yeah.
Just listen to your gut.
All right, the third thing that we need to do to find a great dentist.
Well, you need to practice what you what you've been taught. So
Okay.
you've got the number one, go look for a dentist. Number two, do what they tell you to do. If they want you to do certain procedures, do them. And if you don't trust them, go find another dentist. If they want you to do certain homework, do those things. Do whatever it takes to maintain what they're doing. Follow the instructions.
So, okay, it becomes like white noise. Floss, 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 floss. I mean, that's the main thing that I think most people hear, and most people don't. And that's homework that you're talking about.
It's homework. It takes between 5 to 7 minutes to properly clean your mouth. You can't do it in 30 seconds or less. You've got to spend that time every day. People say, do I have to do that every day? Yes. Yes. I mean,
do you want to live every day?
I take a shower every day. It's basic home, cleanliness.
Sure.
And your mouth is part of your body. You got to keep it clean.
All right, Dr. Chuck, we got a question of the week coming from Tracy. We'll get to next.
Here's Dr. Chuck's question of the week.
Dr. Chuck, today's question comes from Tracy, and she's asking, why is it so darn expensive to go to the dentist, and why doesn't my insurance cover more?
Well, those are two questions.
All right,
okay?
that's true.
Number one, why does it cost so much to go to the dentist? Dental care is not expensive. Dental neglect is very expensive. So the thing we're trying to help people understand is that if you can do the preventive things starting at an early age, okay, you're not going to have that high of a dental expense. If you start, I see this every week. Someone comes in, we told them they had a cavity going on a tooth, but there was no pain, so they kind of let it go, and they let it go, and they let it go, and they let it go. And now, instead of a filling, the tooth needs a root canal or take it out. They say, oh my gosh, a root canal and a crown, now we're getting into some big money. And that's all preventable. We didn't have to go there. And that's the thing I'm trying to, we don't have to go there, If you want to, delay is expensive. It really is.
Yeah.
So if we can get people properly taking care of their teeth, then we can prevent a lot of these problems. Now, the problem's already happened. You've got options of how you want to take care of that problem. Like I say, when you look at the highway, not everybody's driving a Cadillac.
Right.
So you might have some options. You might have implants. You might have a removable partial. You may have a fixed bridge. You may have a temporary partial. There are different things that you can do along the way. I'm right back to the same thing. So much of it is just what you do at home.
Prevent it.
When I was in dental school, they had a plaque in every one of our treatment areas, and it said there's nothing the dentist can do that will overcome that the patient will not do.
Wow, that's powerful. And let's get to her second part real quick about the insurance.
Why doesn't insurance cover that?
Yeah.
That's a really good question, and I think over the next 5 or 10 years we're going to see insurance covering some of that because the insurance companies have already proven if they have a diabetic patient that takes care of their dental needs, their medical needs are down about $4,000 a year.
Wow.
They've got the statistics to show this.
Yeah.
If a cardiovascular patient takes care of their dental needs, their medical needs are down between $3,000 and $4,000 a year. So as insurance, they want to make money.
Yeah, I was just going to say, it's going to come down to money.
Right.
Saving them money.
So
and
if
they'll
the
do it.
insurance company can pay a few $100s dentally to get some deep cleanings or whatever it takes on your mouth and save a few thousand, that's a
going to be a game
big
changer.
deal.
All right.
But so many times people will let the insurance company dictate what they do and what they don't do. And I'm right back to, in the United States, you have choice.
Right.
And you still have choice.
All right. Good question of the week. Tracy, as soon as we get the Your Filthy Mugs in, we're going to send you one. Thank you for your question. We're going to
Your
go
filthy
back.
mouth mugs, not your filthy mugs. We'll keep the mugs clean, I
Oh my
promise.
gosh, that's right. It's Your Filthy Mouth. Your Filthy Mouth. Good catch, Doctor. Okay, so to wrap up today's show about finding a great dentist, what are the 3 takeaways, Dr. Chuck?
Well, number one, do your homework. Find the right dentist for you. You may have to go to 2 or 3 or 4, whatever. Okay. Ask your friends who they trust, who they're, so don't always go from the ads that we see on the magazines or in online. Ask around. Okay. Number 2, let them do their job. When you find someone that you really trust, let them do their job. You already trust them. If they know what to do, let them do it. Don't second guess everything they're doing.
Okay.
And number 3, do your homework, which means if they tell you things to do at home to maintain what they're doing in your mouth, do your homework. That's going to save you time, money, and pain. So so find the right dentist. Let them do what they think you need to have done.
Right.
And number 3, do your part. Do your
Awesome.
part. All 3.
All right. All right. Well, we're going to wrap it up for this week. Be sure to subscribe so that you don't miss any of the episodes. And just take care of your teeth and share it with your friends and family. That's really important, right?
That's the whole idea. Is there are people throughout the whole country that have mouths that have infections in them, and they've got dentists in their areas that can take care of these things. We're helping you to hopefully connect the dots between what's happening here and what's happening with the rest of your body. So make sure you tell your family and friends, or at least the family that you like. Maybe
Right.
yeah, let them know what's going on.
Or don't, and then you won't have to share Thanksgiving table with them, right?
Well, that's possible, yeah.
That was really inappropriate, but have a great day.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.